All right, I'm letting one more in the chat. Terry, I can keep an eye on the chat and let folks in if they happen to get kicked out or as a few folks continue to join. But I think we can go ahead and get started with our Gleaners info session.
All right, sounds good. Again, this session will be recorded, but welcome everyone and thank you for taking the time to join us for the September info session. My name is Terry Brooks Allen and I am the training manager at INRC. And I will also be facilitating the info sessions moving forward, freeing up Sharon to do greater things in the Indianapolis community. This evening, I am honored to present a community pillar, Gleaners Food Bank of Indiana. Tonight, Gleaners is represented by Mary Dubinian and Richard Gordon. Mary is currently the Director of Community Collaborations at Gleaners Food Bank of Indiana. Her responsibilities include identifying strategies to help reduce the disparities affecting the food insecure and providing guidance and leadership on moving towards a nutrition-focused approach to food banking. Richard Gordon is the Senior Manager of Neighbor Engagement at Gleaners. With several years of successful nonprofit management and community outreach experience, Richard has developed and maintained a strong network of positive relationships in the Indianapolis community. Mary and Richard, we are very happy to have you with us this evening, and I will turn the floor over to you.
All right. Wonderful. Thanks, Terry and Sharon, for that wonderful introduction. I'm going to go ahead and share my screen, and then Richard and I will get the presentation started. So we are so excited to be part of the info session for the month. All right. Can everybody, I'm hoping everybody can see my screen. Gleaners Food Bank of Indiana. Maybe there's a little bit of a lag. Terry, can you see it? Give me, perfect. Okay, wonderful. That is so wonderful. All right, we're going to start with a little bit of introductions. I know Terry did mention I am the Director of Community Collaborations at Gleaners Food Bank. I've been there for about 4.5 years. My background is in dietetics. I graduated from Purdue in dietetics, so I'm a registered dietitian. I've worked in healthcare, I've worked in education, and was the Director of Nutrition and Wellness Marketing for Marsh supermarkets when they were still in existence. And my role there was really to help people navigate, the shopping aisles and trying to find healthy foods. At Gleaners, my role is I oversee our nutrition initiatives, our SNAP team. We help all our neighbors try to apply for SNAP. And Richard Gordon reports to me as well in terms of neighbor engagement. So Richard, how about you take a few minutes and introduce yourself?
Yes, I will. Good evening, I should say, everyone. We are just thrilled about 10 years ago in July. And to connect our neighbors to this very important resource in the fight against hunger via SNAP. My role now as for neighbor engagement looks at ways in which different neighbors, community organizations, in efforts to help look at ways to hopefully alleviate the root causes of food insecurity in a community. So we're really thrilled to be here today and glad to have the opportunity to talk with all of you. Thank you.
Thanks, Richard. Richard's going to have a couple of slides here at the very end and really just some shared community resources. What we really wanted to try to come across during our presentation today was talking about eating healthy And I want to share a little bit about what Gleaners is sort of doing in this space in terms of food banking and, how challenging it might be to eat healthy when, people are struggling, obviously, with food insecurity. I'm also going to share maybe some simple healthy food swaps that really all of us can easily incorporate into our meal plans. And then Richard will finish it up with some resources that address food insecurity in our community. A little bit about Gleaners. I don't know how many of you recognize or know that Gleaners serves more than just Marion County. We service 21 counties, and they're identified there sort of in that orange color. And when we say we service that area, we really partner with close to about 300, we call them network agencies, and they help us do the work in terms of distributing food for the different neighbors in those particular counties. And we couldn't do what we do for all of our neighbors without the help of our network agencies. You'll also see a couple of statistics as well in terms of the food insecurity rate that we have in this particular state, as well as our child food insecurity rate. And really what Gleaners is, we're a food bank. If you think about us as a huge warehouse distribution, our facility on the southwestern part of Marion County is about 300,000 square feet. And we love to host tours. So if any of you are ever interested in coming to see what Gleaners does, we would love to host a tour and show you what we do. But I think when people come, they are always amazed and surprised at really how large of a warehouse we are. But to service that many counties and those many neighbors, we need a large facility. We have large coolers, large refrigerators, a lot of shelving space and so forth. So like I said, Gleaners is a food bank. We also have a food pantry on site. Some of you might be familiar with it. We have a drive-through distribution that is in service on Tuesdays, Wednesdays, Thursdays, and Saturday mornings. So again, we're kind of unique in that we are a food bank. We provide all the food to our agency partners, and then we also have our own pantry where we service neighbors, whether they live in Marion County or the surrounding counties and so forth. One of the things that Gleaners prides itself on, and as a registered dietitian, I'm thrilled as well that Gleaners really does put a lot of focus in terms of nutrition. And this is our purpose statement. I wanted to share it with you just to kind of, again, impact that we work with others. We can't do this alone. So united with others, Gleaners optimizes equitable access to nutritious food for those of us facing hunger and strives to overcome the conditions causing food insecurity. And I highlighted nutritious because I think it's interesting. If I were to probably go around the screen and ask each one of you to define what nutritious means to you, I would have a different answer because each of us looks at nutrition a little bit differently. For some, it might be because we have some religious type of preferences, or maybe nutritious food for us means I've got some dietary issues. I'm looking for low sodium or gluten-free. For others, we're finding some other chronic diseases. So each of us has our own definition for nutritious. So a couple of years ago, some internal staff members, we developed a nutrition policy, and we really wanted to identify and define what nutritious meant when Gleaners says we provide equitable access to nutritious foods. So we looked at a lot of different nutrition policies that other food banks were using, and looked at a lot of health-related literature as well. And what we came up with is that what we wanted to certainly promote is nutritious food that promoted long-term health. It also looked at reducing chronic disease risk. We know in this country that a large majority of Americans are suffering from high blood pressure, heart disease, diabetes, stroke, and cancers. We also know that a variety from all 5 of the My Plate food groups, and I'll talk a little bit about the My Plate, also leads to nutritious as well. We wanted to address, as I mentioned, dietary and cultural, religious, budgetary needs and preferences. You know, that's part of nutritious as well. And more importantly, and I'll talk a little bit more about these last three nutrients, but we are looking at foods that are low in saturated fat, low in sodium, and low in added sugars. And I'll spend a little bit more time on that because that's really, for me, as a dietitian, when I talk to neighbors and I talk to clients and patients through the years I've been a dietitian, you know, a lot of times I'm always asked, Mary, you know, I want to eat healthy. Where do I start? You know, we could spend several sessions on that particular question. And I always think about, you know, what is my takeaway message and what can people simply do to get on that path of eating healthy? So we're going to spend a little time talking again, like I said, about the saturated fat, sodium, and added sugars a little bit later. Now, some of you may have seen this My Plate diagram. It's been in existence for many, many years. It's from the United States USDA office in terms of this is one way, it's a visual to teach Americans, if you're going to try to eat healthy, what should you put on your plate? Years and years ago, when I started in dietetics, we had the food guide pyramid. Some of you may be as old as I am, and you may remember the pyramid. Well, that didn't work. Most people thought, well, I don't eat like a pyramid. I don't know how that all fits and all that kind of stuff. So the federal government said, yeah, we got rid of the pyramid and let's look at a plate as a visual for Americans to look at the plate and say, the plate that I eat on for dinner and lunch and breakfast, what is that supposed to look like? So that's where the My Plate visual came into existence. And if you think about it, again, a very basic, if I'm going to eat healthy, what is my plate supposed to look like? If you drew an imaginary line down the middle of your plate, and if some of you are going to have dinner tonight, or maybe you're having dinner while we're speaking, which is great, draw a line down the middle of your plate. And you'll notice that one half should be consisting of fruits and vegetables, and the other half are grains and protein. And of course, we've got a dairy choice there at the top as well. If we focus on fruits and vegetables, notice that, again, I'm not saying it has to be fresh produce. All forms count. Frozen produce is fine, canned is fine, dried is fine as well, and so is fresh. All of those forms of produce should fit into a healthy diet because there are times, you know, here in the middle of Indiana in the wintertime, I'm telling you, don't go out and buy fresh strawberries. Number one, they're going to be high priced and they're not going to taste very good. That might be the time to buy frozen strawberries and frozen blueberries. Believe it or not, canned tomatoes, because of the processing of canned tomatoes, they actually are higher in nutrient value than fresh tomatoes. So when you have a combination of all forms, fresh, frozen, and canned, you really then are creating a more healthy plate. So, you know, a lot of people will tell me, gosh, I can't afford fresh all the time. And I said, you know what, that's fine. Look at what we can do frozen. Look what we can do maybe with canned, as well as even some dried fresh fruit or dried fruit. On the grains, what we're looking at are whole grains. You might have heard, well, brown rice is good, whole wheat bread, whole wheat pasta, those type of things. And then protein makes up about a quarter of our plate. Most Americans, quite honestly, their plates are a little different looking than that. We tend to probably have a bit more protein on our plates than the fruits and veggies. But regardless, if you're looking to kind of change the appearance of your plate, this is a great visual to start with. So draw a line down the middle of your plate, and the one half should be filled with fruits and veggies and the other half with grains and protein. And I've got a couple of examples here just to kind of show you what I mean in terms of some of these healthy plate examples. So just starting really at the left, you can kind of see we've got some strawberries and broccoli. If you drew a line down that plate, you would see that half is filled with some produce. We've got some brown rice, and we've got about a 3-ounce chicken breast on that plate. Moving towards the middle, there again, you don't have to have both fruit and veggie on a plate. You can have certainly a vegetable on one half, but you'll also see that the other half is filled with grains and protein. And then the other plate example as well is just filled with avocados. I've got some tomatoes, onions, and those type of things. So any combination of fresh, frozen, and canned really will suffice for that half of fruits and veggies. Now, the one, as I mentioned, one of the things I wanted to really focus on are these nutrients that I consider, again, these are the saturated fat, the sodium, and the added sugars. These in particular are what we are looking at Gleaners. And you can imagine we get a lot of food that comes into our food bank. We purchase quite a bit. We get a lot of donations, and we also get a lot from government commodities. So it's very challenging sometimes to look at that nutrition label of all the different pounds of food we get and try to determine, is this healthy? Is this nutritious? And then how do we determine that? So when we developed our nutrition policy, we looked at all types of literature. We wanted to make sure we coincided with the medical community, what the science was saying. Really what the science is saying is that these particular nutrients, saturated fat, sodium, and added sugars, highly correlate with the chronic diseases that most Americans are suffering with. Heart disease is definitely correlated with saturated fat and sodium. Diabetes and obesity, we can definitely correlate, and there's definitely some correlation with the added sugars, for instance. So when we looked at all the food that came into Gleaners, we decided, let's go ahead and look at these particular nutrients, look at the content of these particular items in each of the foods that comes in through our doors, and we're going to rank the food. So we rank the food. We have a scanner that scans the UPC code on every product that comes in, and we plug that information into our inventory. And there's a little bit of a diagram there on that slide that you can see. It's kind of green, yellow, and red. And depending on the levels of saturated fat, sodium, and added sugars in that particular food item, it will spit out whether that's a green, a yellow, or a red. And so we call it the traffic light approach, just like you would with the traffic light. Green means go, so that means it's good for you. Yellow is kind of in the middle, sort of caution. And then obviously the red is, it's a little bit high, and maybe some of those nutrients, you may not want to have too much of that. The beauty of this particular system is that it allows us at Gleaners to rank our food green, yellow, and red, so that our pantry partners, and I mentioned to you, we have about 300 partners that help us do our work in the different 21 counties. When they order food from Gleaners to have in their particular pantries, they can look at the ranking and they can see that, oh, produce is ranked green. I want a lot of that green stuff in my pantry for my neighbors to take home. Some of the other items like sweetened beverages, a lot of your Gatorades that have a lot of added sugars, they're going to be red. So for a pantry, if they're ordering some of that, they might say, you know, I'm not going to have quite as much red in my pantry. I don't want to have a lot of sugar sweetened beverages for my neighbors to take home. So when we rank the food at Gleaners Food Bank, it's visible to all our pantry partners, so that when they order food from us and they distribute it to their neighbors in their counties, it is reflective then of hopefully foods that are low in saturated fat, sodium, and added sugars. And this same process that we use at Gleaners is something I want to share with each of you, because it is something that you can actually do at home, or if you're in the grocery store in the grocery store as you're shopping. And the way to do that is to use the nutrition label. Now, a lot of people will tell me, gosh, Mary, I see the label. It has all these numbers on it. It's got words I don't understand, like saturated fat and trans fat and numbers and grams and things like that. And I will tell you, probably the majority of people that I've dealt with will just kind of throw their hands up in the air and say, I don't know how to use a label. It's just really foreign to me, and it's not helping me make healthy choices. Well, we're going to take a few minutes. I'm going to teach you how to use this label, because every one of you can use the label. And when you're standing in the grocery store or wherever you're at, you can make a really good judgment call on whether that food is honestly nutritious or healthy for you. So if you wanted to, we're going to talk about the label right here. But if you can grab something out of your pantry or your refrigerator, and you want to say, you know what, I want to grab something out of my pantry, maybe some packaged items, some cans, something frozen, and you want to follow along and say, I'm going to follow along and see if the food that I have in my pantry, how does that reflect in terms of some of these nutrients we're gonna talk about. So a couple of years ago, it's been about 2 or 3 years ago, the nutrition label was changed. When we started with the nutrition label, it was back in the 1990s when the federal government said, gosh, Americans really need something to go by. Otherwise, how do they know what is in the food that they're buying? So we had this nutrition label from the early 1990s. And then a couple of years ago, about 2, 3 years ago, it got revamped finally. And you might see some changes in terms of some of the calories, for instance, are definitely larger and bolder. Some of the different nutrients have changed as well. But one of the things that really got changed when the label got revamped was really the focus on percent daily value. And if you look at that column, it's sort of that light lavender, light purple on the right-hand side of the label. That's really where you want to focus. You don't want to focus on the calories, the serving size, and all the other kinds of things. That's nice information, but calories does not tell you if the food is healthy or not. Serving size is great because that gives us a little bit of an idea of, okay, what are we talking about in terms of, the calories per serving size, but that's not going to tell you if the food is healthy or not. What we're trying to focus on is the saturated fat, the sodium, and then the third category, the added sugars. And this is that new category about 2 or 3 years ago that the government finally added. It finally added a section for added sugars. So if we look at the percent daily value, the key here is that we want that number to be low. And 5% or less is considered low, meaning that food is low in those particular nutrients that are highly correlated with heart disease, diabetes, stroke, and some of the cancers. So this example that we have right here, it says saturated fat, 4.5 grams. Well, most Americans have no idea, is 4.5 grams a lot? It doesn't sound like a lot, but if you look at the percent daily value, 23% is extremely high. I would look at that particular food and say, I'm not going to buy it. It's too high in saturated fat. I'm going to try to find another product that's lower, that's closer to that 5% or even 10% number. If we look at sodium, 850 milligrams, well, that sounds like a large number, but the percent daily value really tells you that it meets 37% of our daily recommended amount. That's a lot. It exceeds that 20%. And then if we look at that added sugars, well, fortunately, this particular example, whatever it does represent, doesn't have any added sugars, and that's a plus. But personally, I would look at this product and go, it's way too high in saturated fat. It's way too high in sodium. I'm not going to spend my money on it. I'm not going to buy it. I'm going to try to find another product that is lower in saturated fat and lower in sodium, and it is closer to that 5% daily value or even 10%. I'm going to focus on the added sugar. So this is again, if you want to look at some of the foods that you typically buy, just pull out the nutrition label and look at the percent daily value column. That's really what you want to focus on if you're thinking about, I want to start eating more healthy. Then these are the 3 nutrients that you want to focus on: saturated fat, sodium, and added sugars. And every label now has the category of added sugars because it's been changed a couple of years ago. And I'm going to focus a little bit more on the added sugars just because of time. I love to talk about saturated fat and sodium, but the largest contributor to our health problems in this country comes from the added sugars. That actually was the reason why the federal government changed that label 2 to 3 years ago, is because of really some of the health problems like weight gain and obesity, type 2 diabetes, and heart disease. Many Americans were saying, I'm trying to eat healthy, I'm trying to get my diabetes under control. What do I use, and how do I know the foods that I'm buying aren't contributing to some of these chronic diseases. And that really was the reason why the label got changed to have added sugars added to the label. Prior to about 3 years ago, we did not have a separate category that told us as Americans how much added sugar is in the product that we're buying. So here are the facts. Americans are eating and drinking too many added sugars. And I'm going to stress the fact this is added sugars. These are a whole list of different type of sugars that are added to our foods that food manufacturers add just because we as Americans, honestly, we love things that are sweet. So they add it to the product because they know we're going to buy it and come back as a loyal customer. But unfortunately, added sugars in large quantities can contribute to the chronic diseases that we're seeing in this particular country. Now, added sugars is a category. It's not just taking the white granulated sugar and adding it to our foods. Food manufacturers have gotten very smart over the years, and they know that if they put something in that says it's got honey, most Americans go, but honey's natural. Well, if honey is added to a product, it is considered an added sugar. Well, others will say agave nectar, that's natural. But if it's added to a product to increase the sweetness, it is considered an added sugar. So here's a couple of different names that are added to many foods we eat and drink. And you can find this in the ingredient list. You know, sometimes it's called brown sugar, corn syrup, fructose, honey, high fructose corn syrup, maple syrup, all kinds of different names are used, and they're all part of these added sugars that are found in a lot of our fruits, a lot of our beverages and foods that we eat and drink every day. One of the largest contributors of added sugars in our diet typically comes from what we drink. And anytime I show this to people, they're honestly, they're mortified. They think, wait a minute, that's how many teaspoons of sugar are in, you know, one of our favorite drinks. I've got the energy drinks. I'm not picking on any one of these, but it does give a good example that the different energy drinks that are really highly promoted, unfortunately, to a lot of teenagers and athletes, contains, you know, close to 14 teaspoons of sugar in a 16-ounce container. Mountain Dew, favorite of a lot of Americans, a 20-ounce. Again, this is a Mountain Dew, 20-ounce Pepsi, 20-ounce Coke, close to 20 teaspoons of sugar in that particular bottle. So that's why, you know, and I would have to probably say that because that sugar dissolves in the liquid, a lot of people just don't ever think about, wait a minute, there's no way there's 20 teaspoons of sugar in my 20-ounce Mountain Dew. But when you think about consuming that, that's the largest contributor of added sugars in our diet, and it comes from what we're drinking. A couple of years ago, when I was doing a lot more educational presentations to high school students, this was one of my favorite ones that I would do. And I would come into a classroom of juniors and seniors, and I would put in front of them an example of about 20 teaspoons of sugar. That's about half a cup, to be honest with you. You know, I'd put it in front of one of the students, put it on his or her desk, and I go, there's half a cup of sugar here. What do you think? Would you be able to eat that? You know, in terms of, you know, if I gave you a spoon. And many times they're like, oh no, there's no way I'd eat half a cup of sugar. I mean, I'd be gagging and this and that. And then I put right next to it a 20-ounce Mountain Dew, and I said, would you drink this? And yeah, I would drink it. I drink it. It's, you know, I drink Pepsi or Coke and this and that. And I said, you're actually consuming that half a cup of sugar in that 20-ounce Mountain Dew. And you could kind of almost see this sort of, you know, this expression on their face that there's just no way. But when we don't see it, it's dissolved. We don't think about the quantity that we're actually putting into our bodies. So anytime I would counsel, for instance, when I was doing counseling patients, for instance, and I would have a child come to me that would have, you know, newly diagnosed type 2 diabetes, one of the first things I would ask that child is how much soda you're drinking. And quite honestly, if I can delete that and take it out of their meal plan, typically they can control their type 2 diabetes quite easily and very simply. And here's something else that's really astounding. And this is one of the most simplest things that I really share with a lot of patients that I counsel. And I'm not saying, gosh, you got to go cold turkey and you've got to stop drinking it, but drinking just one less 20-ounce bottle of soda each day, just one, can save you over 5,900 teaspoons of sugar for the year. And just by doing that one simple step, that individual can lose close to 27 pounds in a year. That's how much the added sugar contributes to weight gain for Americans. So, when people say, I want to try to eat healthy, what do I need to do? This is honestly the very first place that I go to, and we talk about, okay, some of the sugar sweetened beverages, and they might say, well, I don't drink Mountain Dew and Pepsi. Then typically I will say, do you drink iced tea, sweetened iced tea? Well, yeah, I drink iced tea. A sweetened iced tea can have just as much sugar as one of these bottles of soda. Energy drinks, and the other one contributor and is our fancy coffees. So a lot of the fancy coffees that have the syrup and the whipped cream, and I mean they look wonderful, but instead of a coffee, they've now become quite the dessert. So the beverages are really the biggest contributor of added sugars in our diet. So if there's any one takeaway message and you're thinking, what can I do to try to get on the path of at least eating or drinking healthy, this would be one that I would suggest. And here's a couple of other ideas in terms of healthy swaps. And you can kind of see the focus being added sugars, sodium, as well as maybe that saturated fat. So pick up a cereal box, look at the added sugar category, really focus in on that label as I shared with you. Look at that percent daily value. That's going to tell you very quickly. You don't even have to do any math. You don't have to get your calculator out. Look at the percent daily value for added sugars in your box of cereal. And if it's between that 5 and 20%, we definitely want it closer to 5 to 10%. That's really ideal. Then that's, again, a healthy product with, not too much added sugars. There's a lot of food products with added sugars as well. Your Nutri-Grain bars. I can't tell you how many energy bars, Cliff bars, Nutri-Grain bars. There's a lot of bars on the market too that are promoted to be healthy, but they also have quite a bit of added sugar. Take a look at that label and just make sure that what you're spending your money on is really a healthy product. And again, we're not eliminating added sugars completely. What we're trying to do is reduce really the amount and stick to that 5 to 10% of that daily value. If you buy canned fruit, always buy the fruit that's canned in 100% juice or canned in its own in water. Same with fried vegetables. Anytime you can steam, roast, eat them raw, and try to eliminate some of that fat, that's the best way to go. I tell you what, the air fryers nowadays have really made quite a decrease in terms of the amount of fat that's used in that particular appliance. Same with high sodium snacks. I mean, you can go down the aisle of any grocery store and there are hundreds of different products to choose from. Your option would be some of the, obviously some raw vegetables. But if you look closely at the label, you can find some snacks that are packaged that are actually low in sodium. And that's what you want to look at, is that percent daily value. Same with the high sodium meats, as well as we talked about beverages with added sugars. If you use that label and if you use that 5% rule that I taught you, and you focus in on just the saturated fat, the sodium, and the added sugars, that new category that's on every label, you're going to definitely find foods and products that align more with what we defined as healthy. All right, well, that's really my section. I know we're going to have some time at the end of the presentation for questions. So if you have some, keep those in mind. And now I'm going to let Richard really talk about some community resources in our neighborhoods.
Hey, thank you, Mary. Thanks for that great information. As Mary said, I want to let you all know about some great resources in our community that not only help with addressing food insecurity, but also other issues that contribute to food insecurity that might be of interest to you. The first one here that I want to highlight is a program that Gleaners has, and we offer assistance to individuals looking to hopefully access SNAP benefits. As I mentioned earlier in our introductions, SNAP stands for the Supplemental Nutrition Assistance Program. We have a team of individuals that are very well trained and very knowledgeable about this particular program and can help you or any one of your neighbors or relatives who might be interested in applying for the program. All you have to do is call our hotline at 317-644-1280. Again, that's 317-644-1280. It's all free, so there's no hidden fees and anything like that. I know we're all on the lookout for things like that. And also your information is confidential. We don't go and tell someone, hey, they applied here, you need to go talk to them. It's all confidential. Even if you just have general questions, give us a call with regard to the SNAP program. We're very happy to help. Another resource that I want to make sure you're aware of is our Nutrition Hub. This is a great resource, and it kind of builds off some of the information that Mary shared with us today. But if you want a great one-stop shop location to go to, where you can gain access to healthy recipes, you don't have to be Wolfgang Puck to make these. You can visit our Nutrition Hub. It's got really great recipes, some really good tips for nutrition, and more. So visit www.gleanersnutritionhub.org for more information. And we do have a lot of that information in other languages aside from English, but I want to really make sure that everyone knows about this. It's got some really helpful videos too that are simple. You don't have to be a registered dietitian to access or know what's included in this particular resource here. So again, that's the Gleaners Nutrition Hub. Next slide, please.
I'm having a little trouble here, Richard, advancing the slide.
No problem. There we go. Thank you. One of the things I want to let you all know about is that the first resource and we are just really thrilled. Gleaners has been partnering with Gennesaret free clinics, and we have Gennesaret has been coming to Gleaners each Wednesday. They have their mobile clinic each Wednesday from 8:30 to 11:30 a.m. You know, I talked earlier about some of the different causes issues that lead to food insecurity. One of the things that we learned is access to healthcare is a major issue. This is one way we can feel that we can help. So each Wednesday from 8:30 a.m. to 11:30 at Gleaners, we're located on the southwest side of Indy, Gennesaret will have their clinic present. The medical services and the meds are free. I put that in bold for you. They are free, and it's open to all neighbors, not just pantry users. And the really great thing about this too is no insurance is needed. So Gennesaret's mobile clinic is on site at Gleaners Food Bank each Wednesday from 8:30 a.m. to 11:30 a.m. We get people from all over the county who come to our pantry. If you're there on a Wednesday and feel like you need to talk to someone about some health-related issues, that's a great resource to tap into right there. In addition, many of you may or may not know this, but we have converted our converted to a drive-through model for our pantry. We did this primarily during the pandemic, but I will be honest and tell you that our numbers have just grown significantly. We're serving at least 700 to 900 families each time our pantry is open. But we do have a drive-through pantry that is available. You can get access to fresh fruits, vegetables, protein, dairy, and other items just from in the comfort of your car. All you have to do is drive through, open your trunk, and we will get you through as expeditiously as possible. Now, I want to make sure you're aware of our hours. I know sometimes the information gets tricky, but the hours of our drive-through pantry, again, this is over off Waldemere, 3737 Waldemere, are Tuesdays and Wednesdays from 10 a.m. to 3 p.m. and Thursdays tomorrow, 2 p.m. to 7 p.m. And of course, we do have Saturdays available to you from 9 a.m. to 12 noon. So feel free to come through. You all are invited. Another way to get connected to some of the great foods that we've talked about here today. So those two resources are there. Now, everyone has a smartphone, I would believe. I just really am excited to tell you about this really great app. I know we live in a time where our lives function off of apps. I know I've got several of them on my phone. You don't want to miss this one. Indie Hunger Network has a wonderful community compass. It's called the Community Compass app. It's free, and you can access it just by texting the word hi, as you see there, at 317-434-3758. What's really wonderful about this app, guys, is that you can actually get access to information regarding free foods, also pantries, SNAP locations, WIC locations, and even WIC clinics. You can even, and when I talked about accessing food sources, our pantries, you can get information in terms of where that pantry is located, its hours of operation, and any particular documents that might be needed, if any. I'm also proud to let you know that the app is available in 11 languages, including English, of course, but 11 languages. Food insecurity affects us all, and we want to make sure that all our neighbors have access to this resource. So I encourage you today, if you haven't already, and I think you'll be very impressed, to tap into Indie Hunger Network's Community Compass. In addition, there is also Indiana 211. I think many of us may be familiar with that, but that's another resource there, especially if you're trying to find access to pantries in your neighborhood or in your zip code area. They can help you locate those. Just dial 211 or text your local zip code to 898-211. It's also available in multiple languages. But again, Indiana 211 is a resource that can be of benefit to you, not only with regard to food insecurity related issues, but also other resources as well that might be a benefit to you. Now, I just want to highlight this. I know this is a little hard to see here on our screen, but I'm going to, hopefully we can get this in the chat, but Eskenazi has its new Fresh For You market. This is a market. It's a grocery and pantry hybrid that serves as a self-sustaining model to address food insecurity by providing access to healthy foods. What's really great about this, it's open to the public. Patrons are welcome to shop the market and get access to a number of fresh produce, grocery items, healthy snacks, pantry staples, and more. You can actually access the market itself at Eskenazi, the main hospital downtown off 720 Eskenazi Avenue. The market operates in the Frank and Katrina Basile Pavilion on Monday through Friday from 10:30 a.m. to 6. And what's really great, they're taking it to the street. I might be dating myself, the old Doobie Brothers song there from the 70s, but they have a Fresh For You market on wheels. And what's really awesome about this is that it is going out into the community at different Eskenazi centers that you can see kind of on that lower left area right there. You can actually get access to those, and they'll be going out into the community with their market. Another great resource. I will also want to point out, if you've got your pens and pen and paper handy, you can actually learn more about this by visiting their website. Okay, it's at the very bottom of this slide here, but I want to make sure I point it out to you. It's www.eskenazihealth.edu/food is medicine. I'm going to say that one more time. www.eskenazihealth.edu/food is medicine. So if you know, have neighbors or anyone that might be in need of accessing this particular resource, you can either visit Eskenazi's downtown location, as I mentioned earlier, or take a look at the Fresh for You Market on Wheels at various locations here around the city. So just want to make sure you were aware of that. Next, thank you. One of the things I want to share with you, hunger is a serious issue in our community, and I wanted to share with you that Gleaners recently completed a in-depth research study called Voice of Our Neighbor. And the focus of this particular research, if you will, is one, understanding the factors that neighbors experience when they find themselves in the pantry line. What's causing them to find themselves in that line? Identification of resources to help reduce dependence upon the line. And Gleaners wants to be more community-minded, and we hope to develop a more in-depth way to learn from our neighbors in terms of some of the needs and some of the resources that might be a benefit to them. So I want to let you know that we do have this research study completed. I do have a one-pager of information that I'd be glad to share with you. I'll have my email at the end. If you're interested, you can reach out to me, and I'd be glad to share some information. We surveyed over 800 Hoosiers in Central and Southeastern Indiana as part of this survey. Some of the things that we learned, some of these things are things that we may have heard already, but now we're really glad that, not glad, but we have data and information to support this. But some of the things that our neighbors told us that were leading causes of food insecurity for them were, one, as you might imagine, transportation. Some of the things such as living on disability, or having a lack of affordable housing, lack of access to affordable jobs, an unexpected health event. Other things that cause high rates of food insecurity, being underemployed. And one we all know too well right now is inflation. So these are some of the things that are causing many of our neighbors to be food insecure. And so with that, we want to make sure that we can connect them to resources that might be of benefit to them. For example, our neighbors have told us access to programs like SNAP and WIC are essential. Help with housing, affordable housing is essential. Caregiver support. Also, mental health assistance. Not only we're looking specifically at looking at cost-effective, high-quality assistance programs in that area, but also access to prescription meds are another essential service that many of our neighbors have stated are important. So these are services, regardless of if you live in an urban or rural community, that neighbors believe would best serve them. So you can learn more about this type of information in our Voice of Our Neighbor research study. Next, please. Now, this is a time for you to give us a little bit of your feedback. Anytime we have the opportunity to interact with neighbors, we'd love to learn more. Now, we all have a chat function there where I think we're all familiar with the chat. I'd love to get your feedback on a couple of things. The first question is this, and please just type your answers in the chat for us. Number one, what do you think are the root causes of hunger and poverty that we, as a community, must tackle to help people facing hunger? Is there a particular issue that may not have come up that I may be missing from the talk, the slide I presented earlier? is there anything that you think we might need to be aware of? Just list your response to this question in section 1, and I'm going to give you 1 second to do that. Not 1 second, 1 minute to provide your feedback there. Again, write in the chat there. And there's no wrong or right answer, so you won't be graded. So, but we value your feedback. If you can take a second there, just in the chat. My second question is this. Think about your neighborhood. What needs to be available to your neighbors so that they can thrive? Again, I'm going to say that again. Think about your neighborhood. What needs to be available to your neighbors so that they can thrive? Take some time, think about some of the resources, opportunities, supports that you think must be available. I'm getting a lot of great information here, and it's coming through the chat. So if you want to take a little time just to enter that information in the chat, that'd be very helpful to us. And it helps us to look at ways in which we build healthy collaborative relationships to benefit our neighbors. Okay, great. Transportation, I see that. The bus line, I know that's an issue. Feel free to continue with that. But as I close here, I want to thank each and every one of you for joining us this evening. If you have any comments or any questions about today, feel free to reach out to me. But before we close, we want to see if you have any questions with regard to what was covered.
And as we take questions, if you would please unmute your mic, and feel free to put your question in chat as well. But if you need to elaborate on your question in chat, again, please remember to unmute.
I have a question for Mary. Mary, you were talking about added sugars, and I recently found out about alcohol sugar or sugar alcohols. And what is the difference though? And what exactly is sugar alcohols or alcohol sugars?
That's a good question. That actually is another form of a sweetener. It is used in a lot of sugar-free products, for instance, because it's not technically, doesn't fall under the category of what we would call these added sugars. They don't contribute as many calories as like our category of sugars, but they can still cause, in large quantities, they can actually cause some people some GI distress, to be honest with you. Sorbitol is a alcohol sugar. It usually ends in OL. So xylitol, sorbitol, these are found in sugar-free gums, sugar-free candies, and those type of things. So you do kind of want to watch because there is some caloric content, but they're not, they don't lead to like cavities, for instance, that we would see with sugars and things like that. But it is still another product that you want to watch because it does lead to GI issues.
What would you say, if you know, is the amount that is too much? Because like you said, you'll see like 4.5 and you're like, well, I don't know. Like, is it a percentage, like you said, that we should be looking? How do you know when something is high in alcohol sugar?
You really don't. We don't have a daily value percent set for sugar alcohols, unfortunately. So you're not going to see that in terms of a percent. It's really based on, you know, when people, that's one of those things, is a judgment call. If someone came to me and said, gosh, I'm consuming quite a bit of sugar-free gum and some sugar-free candies and things like that, and I'm noticing some diarrhea, maybe some GI upset, then I would say you might want to cut back on maybe some of these sugar-free products that you're consuming. So it's really more that.
Yeah.
Yeah.
I'm seeing it in protein bars. So that's why I'm like, oh, okay, let's navigate this.
Yes.
Okay,
Yes,
thank
you're going to see it in a lot of products. You know, some even like yogurt products as well. And that's how food manufacturers are kind of getting around. You know, they're using sugar alcohols as a sweetener because of, you know, obviously sort of the bad rap of the added sugars. And then obviously we're getting some, you know, some research and literature on artificial sweeteners. So they're trying to stay away from that. And so now sugar alcohols is another category that can sweeten a product, but too much of a sugar alcohol can give some GI upset. And what we're seeing as well, a lot of these sugar alcohols are kind of formulated for adults, and adults can handle a lot more. But when we start feeding some of these products to children, that's where maybe some of the kids might be having some GI upset. And that's really what we see is really more GI upset, some bloating, diarrhea, those type of things. Yeah,
thank you.
it's a good question. Thank you.
I had a question for you, Mary. I was wondering if I've heard that you should avoid fruit juice because of how much sugar is in it, and I just wanted your opinion on that. Like, because I, as a kid and as a teenager, I always thought that it was something healthy and it wasn't that bad, but I've been hearing more and more that really you shouldn't be drinking fruit juice.
You know that, and I'm glad you brought that up because there is a lot of confusion on that particular topic. Let me explain that there are two categories of what we call sugars. And notice I use the word sugars plural, because as I said, there is more than just white granulated sugar that's added to products, for instance. So added sugars is a big category and so forth. The type of sugar, Danae, that you're referring to is naturally occurring.
Mm.
That's a whole different category than an added sugar.
Mm.
So if you're buying apple juice, grape juice, cherry juice, what that is, when you're referring to, hey, that has a lot of sugar in it, it's a naturally occurring sugar. So when you look at the label on that particular product, you will see 0 grams of added sugar in that product. So what causes that to be sweet is the natural sugar called fructose. And that's where I know a lot of people are confused and go, yeah, you know, there's sugar in my apple juice. What you're referring to is fructose, and that is a type of sugar. But on that label, you're going to have 0 grams of added sugars because it's not added to that juice. It occurs naturally. Two different categories. Now, what you will see, unfortunately, when you see a product like fruit cocktail, orange drink, these are beverages that have in their title, you will see added sugars in those type of products, but 100% fruit juice is naturally sweetened and it's not going to have the added sugar.
Okay, thank you.
Yeah.
So we're right at 7, but Mary, I have one question for you. The sodium, the label that you showed had sodium listed at 850 milligrams. Do we not need to look at the sodium for like the frozen food type meals? Is that sodium amount important or just the percentage?
I would look at the percent daily value.
Okay.
Because here, I'm going to tell you, what we're looking at is most Americans, we need to consume roughly, ideally, 2,300 milligrams of sodium, okay? Most people are not going to remember that number, and they're not going to go to the store and go, oh gosh, how much have I had today? Because I've not kept track of all the different milligrams. Nobody's expected to do that. I don't even do that. But if I want to look at a product and determine very quickly, is this too high in sodium for me? I'll look at that percent daily value and I can make a judgment call within seconds instead of trying to figure out, oh, what did I have this morning? Well, I had 400 milligrams. Okay, now at lunch I had 600 and now I have 800. And I'm trying to add all this up. Nobody keeps track of that. Trust me, I'm a dietitian. I don't even keep track of it. But I can look at a product and I can look at that label and within 2 seconds make a judgment call. And if that sodium percent daily value is over 20%, I know immediately it is too high. And I'm not going to even bother with it. So, and that applies to anything frozen, packaged, convenience, canned. That percent daily value will guide you every time and you will not be misled.
All right, so when I finish cleaning out my cupboard and I'm going to have boxes, where do I take that stuff?
Don't bring it to Gleaners, we don't want it. I will tell you one tip that I always tell patients: if you have canned vegetables that are high in sodium, canned vegetables typically can be high, especially if you don't buy the reduced sodium or the salt-free. One tip is you can take canned vegetables and you can drain the liquid and rinse that vegetable, and you can eliminate up to 40% of the sodium. So draining and rinsing that liquid, or draining the liquid and rinsing that canned vegetable, whether it's green beans, green peas, or whatever, you can eliminate almost 40% of the sodium. So a lot of it is in that liquid. So if you have a canned vegetable that may be high in sodium, don't throw it away, just drain and rinse it. And then the next time you go shopping, look for something that's a little lower. It'll say salt-free or it'll say low sodium. That's what you want to stick with. But if you have something in your pantry now, don't throw it away. Just try to use it up that way.
Okay.
Yeah.
All right. Thank you. Sharon, do we have time for one more question I see in chat?
Oh yeah, the as long as there's questions, we've scheduled to 7:30. We don't normally run that long, but we don't end at 7.
Okay.
I thought you might have been confused about that because you said it's 7. I was like, oh, we got time. But there is another question in the chat, Terry, from Teresa.
Okay, and I'll read that question. I'm shopping a lot for a client search for,
I'm Teresa.
okay.
Yeah, I actually do want to speak on that. Hi, everyone. I shop for a client. The mom is 83. My client have autism, and he with high blood pressure, and she's always sending me for no sodium products. Because doctor said he is to pretty much cut out sodium. I'm finding that a lot of things that it's really hard to find things that says no sodium. You will see a lot of things that says low sodium, but for whatever reason, there is hardly anything that says no sodium added. So Mary, have you noticed that? I know now that you're telling us to look at the daily percentage, at my employer being 83, she's not doing a lot of the shopping I am, which is a great tip for us to look at the daily percentage value that you were saying to look at. But I'm just really concerned about that you're not seeing a lot of our products that has no sodium added. And that's really puzzling to me.
It is, there's a lot of challenge, I will tell you, Teresa. Number one, I will say, as I told Terry, there is a recommended amount of some sodium that we need in our diets, to believe it or not. I mean, we need at least, as I said, 2,300 milligrams. That is a safe and healthy amount. Sodium is a mineral that our bodies do need. Unfortunately, in America, we are consuming, oh my goodness, probably double that amount. So that's why we're seeing all these high blood pressure, cardiovascular disease, because too much of a good thing, unfortunately, is causing us to be sick. So there is a healthy level of sodium that we all need, and we're getting enough of it, quite honestly, in our food supply. So so that's one thing. So I don't want us to all think, gosh, sodium is bad, bad, bad. We do need some of it. And that's why that percent daily value, that little tip that I gave you, if you look at that sodium on your label, find foods that are closer to that 5% to 10%. You don't want to go over that 10%. And that's going to help you for those foods that are not technically labeled low sodium or reduced sodium and things like that. So that's going to help really help you find some of the more healthy sodium items. Food manufacturers, I worked at Marsh for like 7+ years. And so I got to really understand the food manufacturing system. Food manufacturers make products to sell products. And in America, foods that are high in fat, high in salt, and high in added sugars sells. Food manufacturers know that, and that's why they make products that appeal to the American taste. It's interesting because when I was in Europe a couple of times, I found similar products that are sold in American supermarkets. But when I would eat them, try them in Europe, I'm going, gosh, they don't taste the same, but this is the same product. And food manufacturers actually will make different products for the American palate because we like foods that are higher in sugar, salt, and fat than maybe a similar product for the European taste. So unfortunately, Teresa, we're kind of battling, what food manufacturers are insisting that they think Americans like, and that's what they're going to manufacture, and they're going to say that's what Americans are buying. So you are right. You're challenged to probably find foods that are lower sodium, but the tips I'm giving you hopefully will help you reduce the amount of sodium to those more healthy, safer levels that all Americans really need to kind of abide by. So rinsing your canned vegetables, but canned vegetables have come a long way in that there are a lot of no salt added. Soups, unfortunately, there's a struggle there, but a lot of different companies are making a lower sodium soup. So you may have more options there. Anything that's going to be packaged and processed, unfortunately, they're going to be adding sodium in that as well. Hopefully that will help in terms of at least giving you some ideas the next time you go shopping on what to look for. And that percent daily value it is really going to help you decide very quickly, oh, this is too high in sodium. I need to look for something else.
Yes, I think it will. Shopping
Mhm.
for myself as well as my client. I think
Yeah.
I'll start doing it and then introduce it to mom because at 83,
Right.
and she used to be a nurse, so I'm gonna have to ease ease it in a little bit, And will this video, will we be able to have this video or some of this information?
I think so, right, Terry and Sharon? You're recording
Yes,
it, right? Yeah,
yes,
yeah. Uh-huh.
yes, it's
Okay.
recording and it will be posted on YouTube for sure. But yes,
Okay.
you will have access to it.
Yeah, well, I may have to have a session with her. Say, hi, this is something we can watch together. Actually, the company that I work for, she owns the company, so that's why I'm kind of walking on thin ice a little bit with, and not just going straight to her and say, I watched a nutrition video and I would like for you to watch it. I kind of tread lightly with it. But I, say, hey, learn something today. So
Yeah, and
yeah,
I think, and Teresa, you also had that other question, not enough finances to buy healthy foods. I also want to stress that really, the generic and the non-brand foods, they can be just as healthy. And remember that healthy is defined by the level of saturated fat, sodium, and added sugars. That's what defines healthy. It doesn't have to be a brand name. It doesn't have to be expensive. It doesn't have to be organic. Because I can tell you right now, I can show you a lot of organic foods that are high in sodium, high
yes,
in added
very much.
sugars, and high in saturated fat. So the key to health are those three nutrients, and that's where we really want to focus on those three when you're buying foods, and not necessarily, gosh, is it organic? Oh my, if it's not, then I'm not buying healthy foods. Listen, there are organic brownie mixes out there that are high in added sugars. I wouldn't consider them, healthy. So it's that percent daily value that you really want to focus on and learn to shop by using that 5 to 10% rule on those three nutrients.
Okay. Thanks very much.
You're
Thank
welcome.
you all, actually, for this very, very, very important information today. I'm glad
Thank you
Teresa,
for
I did
joining
want,
us.
yes,
Thank
and
you.
Teresa,
Very
I did want to,
informal.
oh, perfect.
Mhm.
I did want to let you, Teresa, and everyone know. So as Terry mentioned, so we'll upload the recording on YouTube, but you'll get a direct link to our website where you can find the recording there as well.
Okay.
So after the session, we'll send out an email with the link, but also an evaluation as well.
Okay. Thank you.
Harry, I thought it was funny that you called the fancy coffees desserts.
They look, I mean, some of them are in the dessert category. I mean, I like coffee, but I tell you, when I see the whipped cream, the sprinkles and the
Mhm.
syrup, I'm thinking that's like a dessert. Yeah.
Does the mobile Eskenazi truck, does that cost for the people, or is it like a pantry and they're just handing out things?
The mobile Eskenazi unit is like a pantry on wheels. They do accept SNAP and cash, and I think that's how pretty much the payment methods are. So SNAP is accepted as well as cash. Yeah.
Yeah, they try to be very cost minded to make sure that individual can access the food. So yeah, visit that website. Again, I'll just say it one more time, www.eskenazihealth.edu/food as medicine. I know that's long, but great. Just tap into that website there. And again, this is all being recorded, so you will definitely have access to the information.
All right, so as we begin to wrap up, are there any more questions for our guests? If we don't have any more questions, I definitely want to thank Mary and Richard for an awesome info session. I definitely learned a lot on Mary's part, definitely learned a lot on Richard's part as far as the resources. So very excited about that information. And again, this session, it has been recorded and you will get a direct link, but it will also be on our website. We hope that you will join us for future sessions. Our session for October, info session for October will be Citizens Energy, and we will be posting and promoting that info session very soon. And we've had a pre-meeting with Citizens Energy. So believe me, it's going to be just as info-packed as Gleaners has been tonight. So again, thank you all for coming, and a very big thank you to Gleaners Food Bank for all that you do for Indiana, and definitely thank you so much for coming tonight, Mary and Richard, and sharing all the information with us. We definitely appreciate it. Thank you, and good night.
Good night.
Thank you. Thank you. Good night.
Thank you so much.